This is the presentation for CBT with depression. So we'll get started, talk a little bit about like some theoretical frameworks for like, why do we get depressed? Why do people experience depression? So there's a few different ideas. There's some theories that look at like the biochemical approach, and that's why we see things like the use of like medications like SSRIs being really effective as far as like part of the treatment of depression. So some theories say that depression might be caused by a deficiency in like norepinephrine. So that's like that kind of like energizing chemical in the body. And we can see that where people are really fatigued, they don't have energy, they don't really feel like doing anything. They have that difficulty with initiating behaviors. Other theories look at things like serotonin, which is kind of like informally known as like the happy mood chemical in the brain. So there we see people kind of struggling to feel that sort of pleasure in life or to have positive emotions, that anhedonia. Other theories look a little bit more at behavior. So if we think about like operating conditioning, which is really just like how you look at the world and whether you receive benefits or punishments for different behaviors, that maybe people become depressed because they don't perceive that they are getting rewards from life. That when I try to get out and make new friends, I get shut down, or I give people my number and they don't call me. And so it's not worth it. I learned that it's actually not effective for me to do these things because I feel worse, and then you get stuck in this cycle where you don't do things that would make you feel better. There's also this idea of learned helplessness, that when people experience negative outcomes in their life, they start looking at them, the causes for those things, as being internal, stable, and global, meaning when something bad happens in my life, it's because it's my fault. That's the internal part. The stable part is to think that this is going to be the case throughout all of my life. I will never be able to experience success or have the life that I want. And then the global part is that sort of mentality is shared with everything. It's, I failed one class, but now I know that I'm just going to fail school, or I'm going to fail everything that I do because I'm a failure in everything. So along with feeling helplessness, a sense of hopelessness is also significantly tied to depression. Some people think that's all it really takes to feel depressed, is the sense that things will never get better and that there's no reason to hope. Couple of last models look at like self-control. So difficulties with monitoring yourself, evaluating yourself, or providing yourself with like positive reinforcement. People who are depressed tend to really pay attention to negative events and the immediate outcomes compared to seeing more of like a long-term approach. I fell off my bicycle. I'm always going to fall off my bicycle. I can't see the bigger picture that when I keep trying, I'll get better at things. They're also they tend to set really high expectations for themselves. They're really self-critical when they don't meet those expectations, and might engage more often in self-punishing behaviors rather than self-reinforcing and self-rewarding behaviors for doing the hard work of living our lives. And one final theory to kind of think about is the cognitive theory of depression, which we're all really probably most familiar with, and we'll kind of hone in on the rest of this presentation, where we look at depression coming from these really negative, illogical, or dysfunctional beliefs about ourselves, about the world, and the future or other people. So at LOA, like our big tool for kind of like pre-screening and getting at some of those depressive qualities is the PHQ-9, or it's the PHQ-A for adult or adolescents. And we can really see like different criteria for depression in there. The difficulty, the little pleasure doing things, feeling down, trouble sleeping. I'm sure you guys are all familiar, but this is a great tool for kind of like checking into frequently to just let people know, like, hey, how are we doing? I think it's a great tool too to see, to combat that self-critical side, to say, well, you feel like things aren't getting better, but when we look at your scores, actually, like, you're reporting that things are getting better, and kind of it can be a helpful tool for like refocusing their attention. So you guys might be familiar with like this idea too of like the differences between depression versus anxiety. Depression, maybe there's a tendency to think a little bit more about the past and focus on how, especially things in the past that went poorly, might impact the future. That because of things not going well before, I can expect that things won't go well for me in the future. Where anxiety is maybe more focused on just that uneasiness and stress and tension about the future, and maybe have less of an influence on the past. But there's also a future orientation with depression as well. This is kind of like a general guideline, but we also see with depressed people, there is that idea that there is no hope for the future. My future is kind of a blank slate because I just know that I will fail or things won't work out for me. So big targets for us are kind of like this CBT triangle. We can help people understand that thoughts, behaviors, and feelings and emotions all really influence and impact each other. Actually, this is something that's a favorite of mine as far as like introducing the concepts of CBT, to kind of draw this out with the client, whether online or on a piece of paper, and show them that this is the model we're going to be working with. And you can run them through an example of, let's take a situation and see how the thoughts that you had affected how you felt and what you did. When you think this isn't going to work for me, you're going to feel unmotivated. You're going to feel a little down and depressed. What are your behaviors going to be like when you reflect on that thought? I'm going to be probably sitting in bed or not doing whatever it is that I really want to be doing with my life, because I have that sense of hopelessness. And playing around with how would a different thought kind of change your feelings or behaviors, or how would, getting out of bed and going for a walk change how you feel or change how you think about yourself compared to sitting in bed. And it can be a simple model to understand, but in practice, it can be really hard to get people to actually engage in behaviors and make changes. A big part is those negative thinking patterns that, it can be really hard to break through, that I really do believe negatively or negative thoughts about myself. I don't feel like I'm a good enough person. I don't think that I can do this. I don't think I'll be successful. And having negative expectations for the world too. People are not going to like me. This isn't going to work out for me. This program's going to be too hard. I'm not going to, wherever I go, people aren't going to like me. I won't be accepted. Other people are better than me. And those negative thoughts about the future too, trying to get people to buy in that things can get better when you believe that, no, the way that I'm feeling now is the way that I'll always feel. And nothing will change. Nothing will ever get better, which can be extremely frustrating, I think, at the individual level as a therapist, because there can be that sense of like, well, what are we doing here? If you're saying that things are never getting better, like, why are you here in therapy? What are we doing? And trying to have compassion for your clients and for yourself. It's a very difficult situation to be in. But I think that's a positive reframe that you can often use to challenge. Like, you're showing up, you're here, you are making steps, you're making attempts, to change your future. So let's play around with that. Let's see what we can do and where this goes. But again, it can be really difficult to get people to engage in those behaviors because of those feelings of fatigue, of, I just really don't want to do this thing. I don't have that energy. I don't have that motivation. I know I want things to be better, but I don't believe that they will be better. So what's the point to even consider engaging in something positive or getting myself out of bed or out of the house? Is just overwhelming. So why even try? And again, having compassion for people here and seeing that like this is their experience, their worldview is that this is too hard. They can also get stuck in really negative patterns where they know they feel bad. The more difficult thing, like, say somebody is depressed and know they want to be out with friends more, but it's just really hard to get out of the house. There can be avoidance that kind of cycles through and reinforces the depressive cycle, where let's say I know I want to get out of my house, but I have negative thoughts. Oh, getting myself ready is such a drag, and I'll go to that party, but no one's even going to talk to me or care about me. And so then you might engage in avoidance behaviors. I'm scrolling on TikTok instead, or watching a movie, or I cancel my plans because I feel overwhelmed about going. And you have that short-term relief. Well, I feel better. I don't have to deal with the stress of getting ready or meeting new people or talking to people I'm not familiar with. And there's that immediate relief, but then that longer term, increase in negative thoughts and beliefs about the self. I am no good. Nobody cares about me. Things will never get better. And partially there's that like self-reinforcement, right? Things aren't getting better. You aren't making, those efforts. You're not having those experiences that are going to show you your future can change. The way you think can change. You can change. And it's just an easy place to get stuck. So there's some big parallels between like ERP with like anxiety, which we're all maybe like really familiar with depression. We have to try to motivate people to be more engaged in their life. And the tricky part is like there is risk, right? You want to be a more social person, but not everybody's going to like you. You might be rejected. You might experience failure when you're trying something new. I want to take a class at college, but I'm worried about failing. And that's a real possibility, right? So we have to try to get people to take that sort of experimental, curious attitude about life and be open to, yes, there could be a sense of failure, or I might experience negative outcomes, but this is worth it for me. I really want to get myself out there. I really do want to see what I can be capable of. And we're little cheerleaders there to try to get them out the door and moving. Trying to challenge too those, ruminating thoughts and those sort of like somewhat like compulsive behaviors about like just thinking about everything that could go wrong, thinking about how it won't work, thinking about how nobody likes you. And again, learning how to diffuse from thoughts, how to notice that thoughts are only thoughts, they're not reality. And also working on challenging those thoughts and replacing them. Can we notice, hey, I'm having really critical thoughts about myself. Can I try replacing that thought? Can I try to stop that thought and challenge it and look at the evidence of it? So one opportunity that we have, whether in person or virtual, to kind of tap into this idea of like, let's get moving and doing something, is something like a walk and talk session. Hey, you're feeling really down and depressed, you're lethargic. Well, we definitely know that exercise can be a great way to start increasing positive feelings, or even going outside and having time spent outdoors. So this is a nice way to have like a little bit of exposure in practice and experience in session, taking some action. Let's go, why don't we go for a walk and talk, and we'll go out and see how we feel afterwards, and make room for a client who says, like, yeah, I'll do it, but this is really stupid, I don't see any point to this. I don't think anything's going to be different. Well, that's okay. Let's notice those thoughts. Let's try this out, and see what it's like after. I think, if it's not walking, there's also room for other sort of like behavioral exercises that we can try to do in the session as like an exposure, as an opportunity to practice this right away. Because what we really want is for our clients to feel that sort of positive increase in mood. I go for a walk outside and, well, you know what? I can notice I actually do feel a little bit better. Feel a little bit more energized. I feel a little perkier. I saw that dog on the walk and it made me smile, and that was nice. And so like we give them that win and help them to start to see that these are good feelings that we can have, and we can cultivate them even when we don't feel like they're going to work. I know for one client of mine, he really wanted to draw. He talked about it all the time. We talked about, what would you be doing if you weren't feeling so depressed? Well, I would be drawing. Well, go grab a piece of paper and a pen, and it felt like pulling teeth in the session a little bit. Well, I don't really want to get out of bed. Well, can you? Well, I don't know where a pen is. Well, I bet you could figure out where one is, and come on, like that constant encouragement until finally we just drew for a few minutes and reflected, and you can hear it in the session. It's a big win for the client, but I think also for yourself as a clinician, when you have that, like, to have that sense of them feeling more positively and like, we are doing something here. Even when they tell me we're not doing anything and there's no point, well, we got to do even a very small thing, and you can feel that sense you're doing something. I can feel that sense too. So that's this slide here, kind of talking about how like we act first and the feelings are on the back end. And this is something I really like to empathize with clients. Yes, that would be so great. You could feel motivated now, right? Because that's the hurdle. That's one of the biggest hurdles to jump through, like, or over. I don't feel like doing it right now. I don't feel like I have the energy to do this or the motivation. I just don't want to do this thing right now. And yet we know that it's when we are more active, that's when we have more energy. That's when we start feeling more positively, is after we do these things. And so really, I think, you can validate somebody's concerns about that and how they're feeling. I totally get it. I wish I felt like going to the gym. That would be awesome. That would be incredible. But I also know that like once I work out or go outside or spend time with friends, that's when we feel better. And so really helping to kind of like lean into like, yes, that is how you feel right now. You don't have motivation, you don't have energy, and this is how you get it. You push through to get to the other side. And again, anytime you can do like something activating in the session and reflect with the client about this fact that like, hey, aren't you noticing that like before we did this, you didn't feel like it would work out, and you felt like no energy and no motivation, and just you were a 10 out of 10 on the depression scale, and now afterwards you feel a little bit more positively. You notice yourself perking up and having a little more energy, and getting them to really believe like, I have to actually like push through, and the rewards are on the other side, but I won't feel it first. So we have tools in the library to help out with this. And especially when somebody is like struggling to motivate themselves or to feel like they have a sense of what they want to do beyond just feeling hopeless and helpless, we want to create some real solid structure and plans. What are you going to be doing in the morning? What are you going to be doing in the afternoon or evening? And try to get, ideally some daily goals. I think especially in order to combat that sense of I'm a failure, I will always be a failure, things won't work out, I definitely recommend making goals that are extremely achievable, right? If we have somebody who's stuck inside, yeah, it would be great if we could go get them to go outside, or they could get themselves to go outside every day and see a friend or call a friend every day. But start with something that's extremely doable. You want them to have that sense of a win and a victory. And the most important thing is to at least, develop some of those positive feelings. Start increasing that sense of hope. So can we start by just going outside, even for 1 second, and celebrate that as a win? Hey, you didn't go outside at all last week. You went outside for 7 seconds. Well, that's nothing. No, that's actually huge. You got past the threshold and you were able to do that. It was achievable. And what you'll often find is that, like, when you set really achievable goals for people, once they meet it, then they feel more comfortable to push themselves further. Or, hey, I know we said I'd only go outside once this week, and I did that, but it actually felt so good that, like, I went outside and I did it twice. Oh, amazing. Now you're exceeding goals. You're, being successful in what you set for yourself. And that's, extremely important, because in the reverse, if you set a goal that's too high or a standard that's too high, you're reinforcing that belief that I'm not good enough. I can't do these things. And so setting as small and as achievable goals as possible, I think, is really important. There you go, Alexis. Great point. Having, right? Crossing things off a to-do list. That's a win. I had something that I know I want to do, and boom, here we go. So I think you bring up a great point, that we can probably support that too as therapists. Hey, because there's also that negativity bias with depression, where people will overlook everything that they're doing. And so for you to really keep good track of their goals with a checklist and, did you go outside at all this week? No, I didn't go outside. I just didn't drag myself out. Well, actually, I went to a party. Oh, so you did. And then you can kind of reflect to them, hey, you had all these goals. You thought you didn't achieve any of them. Actually, during our session, I noticed that you achieved all of them, and you actually surpassed 2 or 3 of them. That's incredible. And helping them try to see, okay, I am doing these things. So to-do list, great idea. Other tools that we have for kind of changing depressive patterns is challenging thoughts. So we've got the behaviors on one end, and then challenging thoughts too. We've got the thought log that's always available in the portal that you can send to them. And again, what's great about this tool too is we can see how things change over time if we can get them to complete it, which is also difficult. Again, great thing to use in session too, where you can kind of challenge a thought in session, see how they're feeling at the start of, having the thought, hey, you said that this isn't going to work, or, that you're the worst. Let's use this tool. I've got this tool. Let's break this down, kind of walking them through in session and seeing how things change and kind of modeling it for them. Really, I understand it is extremely hard for them to do this out of session. We can hope that they do it, but we can also do it in session to at least give them the practice. And again, have a benchmark that we can hold up to them later and say, hey, things are actually getting better. You are actually talking about literally the same thought, but feeling less distressed when you have it now. And I can see that you're able to challenge it more easily or come up with some positive reframes. So a big thing that we can teach and point out to people are thinking errors, cognitive distortions, pointing out that Beck's beliefs of we've got illogical beliefs, and that's what really contributes to our sense of depression. So are there things like catastrophizing, where you're really focusing on the worst case scenario and having really extreme thought patterns and not recognizing that most of life is in between extremes, and that's what's more likely to happen. Or overgeneralizing, where I'm feeling because I failed in one thing, I'm going to fail in everything. Definitely all or nothing. I think most people can have that sense of, oh, I set a goal for myself, I didn't achieve it. I only did 6 of my exposures instead of 7, so I'm worthless and a failure. Well, you're forgetting about the 6 that you did, or any of them that you did. And so really helping people kind of like see these different thought patterns can be really helpful for stepping out of their thoughts and diffusing from them. This is, I'm discounting the positives. I'm using all or nothing thinking. This is like a catastrophic thinking pattern. I can recognize like these are not logical, reality-based thoughts. Therapy Notes has a nice little handout. I put a link on it here, so if you guys want to share it with clients or as a printout, something to hold on to and use in session as like, hey, here's different patterns, right? Can you catch yourself with these? Just to bring more awareness and attention to it. I think like with increasing hope and challenging negative thinking patterns, no surprise to anyone that has met with me or heard me provide feedback, but I love self-compassion. I think it's a great tool. I think it works super well with depression, because depression is kind of about beating yourself up, and we want the person to build themselves up instead. And so major components of self-compassion are mindfulness, self-compassion, and common humanity. Oh, thank you. Thank you, Lisa. And I think clients like it too. I think having that sense of like positivity and encouragement is a really big deal. I feel like it's a victory anytime a client comes back and is like, oh, you were in my head today. I was going to lay in bed. And then I thought like Kevin would be like, you got this. You can do this. Getting out of bed is amazing. You're amazing for getting out of bed. It's really helpful. So mindfulness, that's actually learning how to be present with your feelings and experience and not judging yourself for them and not over-identifying with them, which is especially hard for the depressed person. Well, and the anxious person and anybody, honestly. But I think specifically with depression, people feel like they'll wallow in their depressive thinking patterns. If I really took the time to notice what I'm feeling and what I'm experiencing right now, I'll drown in that. And so I'd rather just avoid it and not touch on it at all. And we want to help people learn how to contact their feelings, contact their experience, and take like a one-step removed approach. This is what I'm feeling, but it's not what I am. This is what I'm experiencing, but this isn't what I'll experience forever. This is just something that's going on in the moment. And you try to help them do that without judgment or getting too fused to those feelings they're experienced. Self-kindness, that's where you try to get somebody to give themselves the same care, understanding, and compassion that they would offer a friend. So an easy way I like to challenge people in session using this is, using a friend test. How would you talk to a friend about that? Let me tell you, the exact same thing that you're telling me. And let's see how you respond to that. Oh my gosh, I'm just so stressed out right now. I can't get out of bed. I got dumped a few weeks ago or a month ago, and I'm just still not over it. And like, I feel like nothing's going to help. Nothing's working. There's no point. And so I'm just stuck and I don't know what to do. I don't think it'll ever get better. And I've never had a client give me, when I ask them, what would you say to that? It's never, well, you're a worthless piece of garbage. Of course, that's what you're going to be feeling, and you're going to feel like that forever. It's always encouraging. And so helping, using that friend test can help them kind of find that kind voice for themselves. And then the last big component of self-compassion is common humanity. Except that like we all struggle. We all experience pain, discomfort, failure. All of us are imperfect. We all want to be better. And instead of seeing like your failures as something that makes you less than other people or is something that makes you somehow worthy of contempt or isolation from others, actually, this can be something that can connect you to people. You know, we all go through moments where we feel worthless or depressed or challenged. And when you can have that sense that this is actually something that connects me to humanity, that makes me human, it's part of my human experience. Well, now, like, I think of a client who really said it well when he was like, I realize, like, also that, like, people get through that. And that's something that I can feel inspired. I can tap into that sense of movement forward because I know I'm not the first person to feel depressed. I'm not the only one that struggles and suffers. And I can feel motivated when I can recognize other people are working on this too. And other people have gone through this, and I can too. So if you like self-compassion, Kristen Neff's website is linked at the bottom. She's got 8 exercises for like developing self-compassion, and they're super easy to talk through in session or to share with clients over the portal with messaging or email. Okay, so we've got like a little role play exercise. I don't know if we want to do some like Q&A first though, if anyone has like questions or thoughts. I personally feel like the depressed client can be especially difficult